were on a very high altitude, so a lot of turbulence and all that. But I think the flight will be smooth now. Okay, so we were saying before the break in transmission that the prevalence rate of adolescent substance abuse varies from one setting to another. In India, the survey that was done in suburb of India um, reported a prevalence of 31%. And a, and another study that was done in Bayelsa, it gave very high values of 90%. But this study was not just among adolescents. So adolescents from 15 years up to adult ages of 65 formed the study population. So that would explain why the prevalence was as high as 90 as compared to 31% that was recorded in India. So different parts of the country have also recorded different prevalence rates. Southeast 39% to 56% in Lagos. The values keep varying from one setting to another. And the pattern of substances abuse also varies according to different economic statuses of the study participant, as well as the sociocultural factors in each environment. Whereas in places like Enugu, Kola Nut was found to be the most abused substance among secondary school students for obvious reasons. They want to take this Kola Nut to stay awake and study. And places like Eket in Akwa Ibom State had different substances that were being abused, alcohol, cola nut, opioids, and the rest. So alcohol, hard drugs like cannabis, cocaine, heroin, and other illicit drugs have been reported in different settings. There are videos of young girls, five secondary school girls, abusing shisha in school uniform. Although these 5 years had been, you know, identified and detoxified and sent to rehab, there are points that may have not trended in videos, and one may not really know what exactly is happening in different settings until there is a conscious effort to seek into what exactly is happening in different settings. So,
Okay, so the burden of drug abuse, like we said, affects everybody. So notable celebrities in our society have actually been victims of drug abuse. Whitney Houston, this famous singer that we know that died a few years back, she was actually abusing drugs. Most commonly, we have, the famous boy band One Direction, Liam Payne. He recently died, and after his toxicology was done, shows which was why he had a psychotic break, wrong reports, and then fell down a story building. So this also we have Marvin Gaye, Brenda Fasher, well-known rapper in America, died in 2021 at the age of 50. And was also using drugs. So it affects everybody, like we've been talking about, not just these celebrities. I know adolescents usually view celebrities as people that
role model, and they want to model themselves after. For Marvin Gaye, some people will argue he was the father, that was a pastor, a man of God that shot him. Now, if not for the fact that he was abusing drugs, now deviating from the family pattern, as a man of God, you expect that your child should take after you, should model Christ and all that. Now, singing, sexual arousing songs, and engaging in alcohol and had drugs, that wasn't the pattern in the family, annoyed the father, leading to the father going to, you know, end his life. So indirectly, his way of life was what indirectly affected the father's decision to end his life. And if we let's not forget Michael Jackson, renowned pop singer that couldn't sleep because of lots and lots of issues. So he had to call his personal doctor to give him propofol. So you know the story of the propofol, the cardiologist and the litigations that followed. And so drugs, it can be traced to so many problems, is up to the point of people's lives being caught in in their prime. The National Demographic Survey and then Center for Research and Information that's sponsored by United Nations Office of Drug and Crime reported prevalence rate of between 14 and 14.8. But the um, documentations from different researchers across the country actually gave values higher than this. This is actually community-based survey, so it's more reliable. But most of the studies done are targeted studies, either those in school or those that presented to the hospital and all that. So that could explain the variations in the value. And 14.3 million people aged between 15 and 64 years have actually been reported to be abusing drugs. One out of every seven individuals had used drugs. So in this conference room now, if there are like seven of us, we can, if we do random urine drug testing, we'll find out that there's somebody, I don't know whether it's Victor or some other person, or a man, or there will be somebody here that is abusing drug other than alcohol or tobacco. Alcohol and tobacco are illicit drugs. They are permitted in some environments, so they are not illegal in some environments. But the other ones that are illegal, the illicit ones, as we call it, are actually abused by one out of every seven persons. And when we talk about gender inclusivity, one out of every four, that's 25% of abusers are women. So this one is not a question of saying is a male thing, the male dominated issue or disorder. It actually affects um, both genders, although it's more common in males.
Drug was from the research known is cannabis, and the age is usually 19 years of age. That's like late adolescent. And 12.6 million people think opioids in tramadol. So nearly one in every eight person, that's total of suffered from another person's drug abuse. Drug abuse effects can be direct or indirect, so either affecting the person living with you or your parents, your family. So this one in every eight persons has been affected, meaning that you don't have to be the person taking the drugs. Because the person is on drugs, maybe they're having a psychotic breakdown, abuse, they can be abusing you, and it's all when it's traced on it's because they were abusing you.
So being more practical now, let's say a husband or a wife is abusing drug, that family dynamic will not be the same. Now, a father that is abusing drug will not be able to make very sound that will affect the family. A father that is abusing drug may not be working, and if the person is not gainfully employed, that means the whole work of providing food for the family will now fall to the wife. So directly or indirectly, while it affects the individual in question, the persons that are related, to that drug abuser will also suffer. And one out of it from this survey from the United Nations Office on Drug and Crime, showed that we have that kind of affectation in the people that use drugs.
176,000 really high risk. And injectable drugs, that we talked about opioids, cocaine, heroin, which is why when you check random people on the streets, they have all the injections.
Yes, you see marks.
Yes, even in between the finger and in between. And only drug use also. Like, so most people don't abuse just one drug. Mostly they start with one and then you see a combination.
The gateway substances like alcohol and tobacco that most of them will start with. Then from alcohol and tobacco, they will now move on to marijuana, move on to methamphetamine, cocaine, heroin, and all these combination, later combination of things. There is loud, the one they call loud now. There is Captain J, so many things. Shisha, I was surprised one day I went to get something and I saw Shisha pots on display with the amount tagged. I was like, it's no longer hidden. People now go to buy these things, and for those supermarkets to actually have them, for those pharmaceutical shops to have them, means that invariably the substance abuse thing is even being advertised now. Listen to music, even Grammy award winners, you see them popping, pipe and all that, folding their wig. There are some on Olamide's songs you see, uh, turn up, you see him dancing. They turn up, turn up with the wrap of his wig, releasing the thing into the air, and people were dancing. There's no way you watch all those videos with the level of excitement on display, and you being an adolescent, you not want to try to be happy like the people that are singing all those songs. So the uh, uh, other problem with substance abuse is that high risk abusers, get to a point where it will be difficult for them to even access treatment. And states like Yobe, Imo, Bayelsa, Rivers, and Lagos were ranked among the states where it is difficult to get treated if you are abusing drugs. There is a drug rehabilitation center here in Abuja, somewhere in Yobe, that was formed by somebody that was abusing drugs in Ghana, was rehabilitated, came back to Nigeria, now set up the place. So we are we are lucky in Abuja to have such a rehabilitation center. But when you now look at the level of autism, some months ago, rival courts were killing themselves in Abia State. Just wake up and see one fine boy lying in the pool of his blood. He has been wasted by rival gang. Banditry that is happening in Zamfara State. A lot of people have left the Zamfara for them. They are not collecting taxes and all that. It's related to substance abuse. In the subsequent slides, you see some of the people that were caught by the law enforcement agents as being suppliers of drugs to these bandits, insurgency, kidnapping, rape. All these things are not done with clear eye. There's nobody that is higher centers are under standard temperature and pressure that will be committing on those crimes. So they take very strong substances that alter their sense of reasoning. There's also um, the news of a young girl, side chick, that went to the hotel on a sexual romp with the sugar daddy, super TV CEO that died in the hotel. The girl has been arrested and is undergoing, is being tried in the court. Now, her account of what really happened, had it that they actually took hard drugs, him and the man. So at the height of that, substances they took, she didn't know what to do, and she um, killed the young man, very young man, married with wonderful children. So it's just for you to know how bad this substance abuse thing is in our um, society.
Drug law enforcement agents recently arrested
Nigeria.
Nigerian who supplied both and talking about her banditry when you trace it back there as well. And another 35-year-old Chadian was arrested a week after Taraba State assaulted. So out of this, right, we got like 21.70 kg of drugs, which is like 5 this high of it.
So we don't use it. We use low dose 50, 100 milligrams for pain alleviation. Now, when you have high dose, it's doing some other thing. It's not just for pain control again. It's actually for highness, His Royal Highness.
Development goals because of the rising challenges in youth. Target the target 3.5 aims at strengthening, preventing, and treating.
So the 17th Sustainable Developmental Goals that is targeting that by 2030. So we have a very society where there's water, where there's no poverty, and all that. Saw the importance of combating substance abuse. So that's why target 3 to 5 is actually aimed at preventing the strengthening efforts at um, containing substance abuse. So this was a paper I presented in the annual general meeting of the West African College of Physicians in Gambia. So my part 2 work was on substance abuse, and I compared self-reported abuse with a urine drug test and confirmed adolescent substance abuse among 400 secondary school students, both those in private and public, those in educational and single gender institution, as well as those in urban and rural communities. Now, from this study, we're able to establish that the lifetime prevalence, the first level, yes, the lifetime prevalence, that's from the time the child was born up until that's the period where the study was done. Those that had ever used one substance or the other were as high as 3%, while those that were current abusers, that's those that were using substances in the past 30 days, were around 56 percent of the study participants. That's 50% of 400 students. Then for urine drug testing, now find that around 36% where that's the lemon. Yes, so just for you to know how the variance between self-reported abuse and urine drug test obtained drug abuse. Now, as self-reported abuse can overestimate the rate of abuse. Somebody that is not really abusing any drug can say I'm abusing. Whereas, urine drug testing will objectively tell you who is currently abusing. But the pitfall of urine drug testing is that if the person abused the drug beyond 5 days before the person's urine was tested, it may be negative, like in our index, that all the parameters were negative, depending on the half-life of the drug being abused. Now, there are drugs that the half-life is just 2 days. There are drugs that the half-life is 5 days. So if you do the test after this um, half-life has elapsed, the result might come out negative. Now, the time while the child was on admission, it wasn't the following day that the test was done. The child was on admission for a number of days. So by the time we reasoned in the line of the substance abuse and did the test, probably the half-life of the drug in question may have elapsed. The second graph there, compared the different substances being abused. From here, you see that there were some substances that these um, adolescents agreed that they were abusing that couldn't be found in the urine drug test. Like that first one, there is no corresponding urine drug test isolation. Then you have this other one, the methamphetamine. A lot of them did not agree that they were abusing methamphetamine. Methamphetamine is popularly known as Nkurumiri in Southeast. So it's very, very, very common. A lot of adolescents are abusing it. But their urine drug test showed that a number of them were abusing it. So this tells you that you may not just rely on urine drug test or self reported accounts. You have to do a combination of the two for you to be able to identify those that are abusing substances. These other studies, a systematic review, meta-analysis of the factors associated with adolescent substance abuse in Africa. So this was a survey that was done over 20 years, between 2020 and 2020, between 2000, the year 2000 and 2020. Now, there were two major factors that were seen across different countries in Africa as being associated with substance abuse. One is male gender. Males were found to abuse substances more than their female counterparts. Some of the um, papers we shared, before showed them a prevalent ratio of 1:4. That's 25% females, 75% of males abusing different kinds of materials. So this systematic review mirrored that as well. Then the other risk factor, the second risk factor is older adolescents. So the older the child in their adolescents are grouped into early, middle, and late. The early is 10 to 13 years, middle is 14 to 16, then 17 to 20, 21 is late adolescent period. Although for us in pediatrics, we're looking at 10 to 19 years according to. So those that have been found to abuse substances are late adolescents from the systematic review. So whenever you're in clinic and you're seeing, you know, uh, male adolescent, although what we presented was a female child, but that female, that 25% is somebody's sister, is somebody's daughter, is somebody's relative. So in as much as we look out for this thing more in males and older adolescents, we shouldn't close our eyes to females when they present, because you can also have them abuse one substance or the other.
You know, deal with this burden, what can we do different? So starting from management, when we use our case index case, when you're managing a child that presents to you in such a case, we start from the history. Like we mentioned, took a history of what preceded the parent's event, what's her behavior before, family history, very important because we're able to establish that we are most likely not dealing with mental illness and something that started suddenly. So there had to be a trigger. Then physical finding, also important. Like we mentioned before, somebody abusing drugs, especially if it's IV, see injections, hear, that somebody sniffing cocaine. You see all these frictions from the nose. You can see like from clinically, from physically, sorry, from examinations.
You generally see some of the things I'll tell you that something is happening. Somebody that sniffs cocaine, there is this hyperpigmented patch, redness, erythema and all that around the nasal area that will tell you something is happening around this. Then maybe somebody that changes environment and is not able to get hold of the materials he or she has been abusing, find that such a person will be having withdrawal symptoms, which should actually rouse that clinical suspicion of the substance abuse. So the physical examination is important. Screening for psychiatry, you need to know which material you're screening for. It's not enough to just send for urine drug test. When you have, let's say you have a background and history that this person is using cannabinoid oil because it's another recent craze. People use it for seizure control, use it to help them with sleep and all that. So if somebody is abusing something like that cannabinoid oil, the urine drug test you send for, you have to ensure that there is actually um, marijuana, that's the metabolite of marijuana in that kit. If you just do the one that has other things like cocaine, heroin, benzodiazepine, methadone, and the rest, it will come out negative. But that doesn't really rule out substance abuse. So it's very important that you tailor whatever test you're doing to what you're suspecting as being responsible for or what the person is actually abusing. So diagnosis requires that you use your sound clinical acumen. It's not enough to just say, okay, let's wait for the urine drug test to come out. It might come out and not show anything, especially if that person has abused the drug beyond 5 days before presenting. So the history is important. Physical findings that you find when you are examining are equally important. Then your ability to now know which investigations to do, and even when the investigation results are returned, your ability to properly interpret it, given the background knowledge you have about substance abuse, will help you make a good diagnosis. Then by the time you make the diagnosis, you the next thing is to treat. So the treatment will involve detox. If the material is in the child's body, you want to give some time for the whole thing to clear. You can give a normal saline, and if it's a drug that you know very well, like opioid, you can give naloxone as an antidote and all that. If it's other drugs that you don't really know what it is, just give monosol, and after some time it will clear from the system, and you see some of the symptoms that the person presented with gradually, wearing off. And most important, it's not enough for you to just detoxify. You also need to properly follow them up. Those that need to be rehabilitated, you send to rehab. And rehabilitation can take as long as 2 to 3 years. And a very good rehabilitation facility shouldn't just be about helping the person stop abusing the drug. There should also be provision for vocational therapy, provision for maybe kind of vocational training so that the person gets to find something doing. If it's tailoring, if it's carpentry, if it's one artisan work or the other, that will help the person put food on the table. So those are some of the things that can be done within that period. So that if the person is self-reliant, most people, most families, once they realize that their person is abusing drugs, they will disown the person. So when you were done treating and you want to send back to the family, stigmatization and other things might make the person fall back to those gangs or those groups that even pushed him or her to. So it's good to have this at the back. manage, be able to do the needful.
I think it's really usually works well, trying to identify somebody is dangerous. Like we just about the self-reported question, and the example of the father and the child. I really think that when a father asks their child, you have to child. So the fact that questionnaire itself can rely on the challenge. Then urine drug test will be negative, like he explained. When your child comes to you like a week after taking drugs, maybe parents have brought them to rehab and they're like, do a urine drug test. Like come on negative and you think okay. But it's because they have life. And so that is why you don't even schedule a drug test. Just just pick them and take them to the lab.
It has to be mandatory as well. Because if you leave it as if the person wants to do, yeah, if you want, give me your urine. If you don't want, you can leave it. The person can actually plan to submit the urine sample when he or she is sure that the whole thing has clear. It has to be random. So that's how most drug cheats in track and field are picked. Most people that use drug in football are picked, like the Chelsea left winger. And there was a time Victor Osimhen performed so, wonderfully. He had an out of this world performance. So at the end of the match, while he was on his way to the dressing room, they cornered him and collected his urine to check whether this one is normal. It's clear eye that it came out negative. So mandatory random urine drug testing is one of the ways to, pick people that are at this zone.
That challenge is like talk about implementation can take 2 to 3 years. Anybody that hears that is not really follow up like because you might just look for them the following year and you don't even know where they are. And then by the time you find them, so novel substances, like we've been talking about other substances that are not really very panel, you'll not be able to pick. So you now think, okay, this is something else other than substance. How many management facilities? So mentions of states, like in my possibly not even have mission center. Even in Abuja here, besides the one in UK, I know there's another one, but all these NDLE rehab centers. But those ones, when you look at it, rehabilitation doesn't really mean okay, just doing off, withdraw from drugs. You need a psychologist to be there because most of them have reasons why they're using the drugs. Once you just
They may have marital disharmony. Let's say somebody that loses the job now may be depressed, now resort to drugs to forget his sorrows. Somebody that the husband abandoned with the children may resort to drugs. There was a time we had one woman that the husband had left the kids and the child was brought to the hospital unconscious. They left one bottle of nobody knows what it concussion it was, and the child mistakenly drank it and was unconscious. So these are real life things that can happen, and if we don't have this background information of what exactly led to the abuse, you detoxify the person, and the person goes back to the same environment and encounter the same stressor that will make him or her go back to the same drug that even brought him or her to
all these people, so
Yeah.
they usually are used to cure it. Once you can't just say you withdraw them from because people cell is for life. So what if you send them out? They'll still go out to addressing the drug. So and then finally the experience of the healthcare person very, very important. The point of this presentation because once the person does not really know what they're doing, so it's going to be difficult for them to even know how to treat the person with the substance.
Let's say this child now, that was talking irrationally, shouting, not being able to sleep and all that. And there was no suspicion of substance abuse. This child can be taken to a mental health facility where they will be loading the child with antipsychotics, and with the antipsychotics, extra pyramidal side effects will now come. logary crisis and the rest. So you don't know what you're treating. The child will just be, looking up and moving in a very funny way and all. So it's good for us clinicians, on this um, platform that in, listening in to this presentation to know that this substance abuse thing has taken another dimension and all that. So can actually uh, uh, have that at the back of your mind so that when anybody presents, you'll be able to identify and manage accordingly. So there are some, okay, okay, so just one question on the chat box. Can you include an SOP for urine drug testing? Considering the new aspect? Okay, so it's very, very important for um, our facilities to have a standard operating procedure because this child has had taken a cape from the teacher. The parents might actually want to sue the school and the teacher for you know um, the substance abuse that the child was exposed to. So but the thing now is if you're the clinician seeing and you need strong um, laboratory evidence that this child actually abused what you're suspecting, the urine drug test needs to be positive. So there has to be a way to incorporate the self-reported questionnaire finding to the urine drug testing so that when any medical legal issue comes out from this kind, be able to use it as a benchmark to actually do the needful. So I think that helps.
We talk about how the drug abuse itself affects the individual, family, the community as a whole, and the economy. So the level of prevention has to come in stages. So from an individual aspect,
There has to be this risk perception. Now, if a child doesn't see the problem he's entering into, he may want to experiment anyway. If he sees that his friends are doing it, he might want to follow them and do, the same. Or if the parents from the family level has been able to teach this child that in this family we have a name, we have an identity that we don't want anybody to smear in the mud. They will not want to engage in uh, the regulatory activities like using substances. So at the individual level, if the child has this self-awareness, has this self-concept, and is able to develop thick skin against peer influence, then you'll be able to prevent substance abuse at the individual level. So the different phases of adolescence, you see different levels of complete of operational functioning. Now, early adolescence is a period where most of them will want to, share affiliation with uh, their peers. So for them to have that a bit of stability. They want to identify with peers of the same gender. So if your child mistakenly aligns with another child from a broken family that is watching the father abusing one block or the other and decides to bring it to school and gives and offers it to this child that has come accustomed to this child, that would just be the first step of that child using a substance. Then when you get to the middle adolescent period, now they try to be more inquisitive. They try to reason. They want to see the implication of something they want to engage in before deciding um, whether or not to do it. So they may actually see the future implication of this thing, but they don't actually factor this in their decision making, whether to do it or not. It's more of they will ask questions. Depending on the answers they get, they will now decide whether they will do or not. So this adolescent period is another period where kids may venture into this adolescent substance abuse. So the parents need to be there with the child to answer all the questions. If there's anything the child has heard out there in school, the parents should be able to counter it and say, okay, no, this one they are saying is not. This one they are saying if you're having a menstrual cramp, you have to take this for you to sleep and forget your sorrow. The parents should be able to say, this thing is just a mean, something that will happen for the meantime. Once you're able to wait 1, 2, 3 days, the pain will subside and you will go back to your normal life. Normal painkillers, opioid can actually help you achieve that. Then during the late adolescent period is when those that will be odogu in this substance abuse that have gained, enough footing from what happened in the early and mid adolescent period. Late adolescent period, you now find that they are able to make their decisions independently. They don't even need the gratification of their parents to decide what to do or what not to do. They have this, you know, perception and the absolutism in anything they resolve to do, even if you try to prevent them from doing it. Once their mind is made up about it, they will end up doing it. So that helps us to understand that during adolescent period, if you don't monitor these children, what they are doing, and be able to, have ready answers, for their decisions and all that, may end up um, losing them to some of these societal vices like substance.
Important to know that in family level, most cases of substance abuse really families where there's someone like either there's like both parents are in an abusive relationship and children are actually seeing it. There's depression, foster care. So most children you see, especially in the US, once they have a bad experience in foster care, most of them fall into substance. So or they've been abused by their foster parents, or they've seen their foster parents abuse drugs. So on a family level, how we can prevent this is when you have good role models and when parents are able to know that even if they are not together, they are separated, their children shouldn't be a situation where okay, you guys are fighting, we talked about how adolescents, early adolescents need your parents to be there to guide you. So imagine in a family where the parents are unhappy, they are just focused on fighting each other and they're separated. Nobody is really there to guide you and show you, okay, this is not something you should do. So you fall back to your peers, you fall back to people that you can help you. And by the time the parents are welcome, you're already waiting to their
We'll now go to the community level. There's what we call fighting back and breeding. These are different things that different communities in the United States have tried. So there's a way community leaders are able to identify families very, um, um, is called the families that are in disharmony and all that. So they try to like ID this family and ensure that whatever is going on there doesn't affect the totality of the whole family. And there's also a way that the security agents are notified about some potential know, um, families that the parents are abusing drugs and all that, so that they will come and sort them out. Children in that kind of setting can actually be withdrawn and sent to foster homes where um, they will achieve some level of stability and not ending up being influenced by the bad examples of their. So this was what they did over there, but we can actually look for what can be domesticated in our setting. If, for instance, you're living in an estate, there's somebody you know that doesn't have something very, the person's occupation you don't know, what the person is doing you don't know, or sure the person is one of your neighbors and is driving big cars and all that. If you don't ID and isolate that person from that place, the person will serve as somebody that will be giving information to those that will be coming to raid that estate. Before now, you hear that once you're staying in an estate, there is safety. There's hardly robbery and all that going on. But now you hear a lot of you know um breaking into people's homes in estates, people being abducted in their estates. And how did those people gain access into that place if there's nobody inside that tells you, this guy no do go, this guy go. If you hold this guy, please, ransom will reach 10 million. So those are some of the things that if we don't do at the community level, if our religious leaders consciousness of their members, if congregants are not, schooled on the dangers of substance abuse, if our school curriculum doesn't have something substance, I was actually impressed when I saw some of my kids in primary school. I saw that their textbook had, pictures of substance abuse where they were told the harms, that one can bring upon himself when he engages in all those tobacco, smoking, lung cancer, and all that. So I was quite impressed. I say, so if our school curriculums can have, outlines on the consequences of drug abuse, it will help deter the proclivity of our kids to some of these substances. Gather counselors. Those when we went to school, there were teachers, there were guidance counselors. Anybody, any child that is misbehaving, mischievous child, you see them, invite them to their office to have a pep talk with them. And we are surprised that the ones that were, a bit the bullies amongst us and all that, you find that with that pep talk over and over, they actually turned a new leaf and started acting better. So our schools now should also incorporate that so that our communities are able to identify potential future drug abuse disorder subjects and try to nip that tendency in the body.
Environmental level, we talked about how many rehabilitation centers we have everything. It's important that we have any that we can take our substance abuse users. And it's important to improve public awareness about what these drugs can do and their side effects and not just rehabilitating somebody and sending them. Most people actually they continue seeing their psychologist. Some actually need therapy after drug. Some need to have youth empowerment services available. We need to our communities, our government should be able to provide jobs because like in Zamfara, we're able to find out that most of these bandits are unemployed. Most of the people that were abusing drugs really they fall into because of depression because they didn't have any jobs. So once you provide these opportunities for them, it will be likely for them to want to go back to those substances because it was a way of coping for them to deal with what was happening in the place. So in general, having the burden of drug abuse, the management involves us working together on an individual level and mental level to ensure that we are able to manage and treat anybody that we see with substance abuse and help them not go back to the same thing again.
I believe that our time this afternoon was not wasted. We were able to help us understand the dangers of substance abuse such that if we see any child, any adolescent, or any patients present to us with some symptoms that could be linked with one material or the other, even if it's not the well-known materials that is being abused, we should be able to raise our level of clinical suspicion. Because adolescent substance abuse is still a very high burden, and the prevalence rate is not just high in developed countries, even in our equally high. And it's worrisome that some novel substances that have not been properly documented are actually currently being abused. So we call on all stakeholders, health care workers inclusive, to incorporate activities that will help in early identification and the reduction of drug demand by adolescents. This will help us contribute our own part to the global fight to reduce the perturbing level of adolescent substance abuse, you know, because they are the vulnerable people in our society, and they are the ones, when we leave this stage, they are the ones that will take over. Just imagine, let's say um, you're a bit under the weather and you present to the hospital to see a doctor, and you see this doctor with tattoo beating all over, with weed, wraps of weed on the table, telling you, hey, madam, what can I do for you? Just imagine you being on the other side, what you feel. It will be a very pleasant experience. So let's just put our hands together and ensure that we, you know, stamp out adolescent substance abuse in our society. Thank you. If there are questions, you can, put them on the chat box so that we can answer them and all it day. Thank you. Let me apologize again for the issues that we had, network challenges and software issues. So sorry, we promise that it will not recur subsequent presentations. Thank you, and thank you.